vessel model. What a pain that was. Well, it's not quite as bad as that. So the scrotal sac, here it is, the scrotum as it's more usually called, just to hold the testes. Developing testes or developing sperm need a slightly lower temperature, so that gives them the opportunity to cool off a little and have the slightly lower body temperature for proper maturing of them. The spermatic cord is actually this whole thing here, which has apparently been cut off and reforms along here. So there's a tough sheath of connective tissue. There's veins and arteries and nerves and all that stuff. And there is also inside it the what used to be called the vas deferens and now is called the ductus deferens. So when you have a vasectomy, that's what it would be. And that's this little part here. So the ductus deferens is the part that's carrying the sperm as part of the spermatic cord, obviously the main part, but the whole spermatic cord actually includes all of it, and the ductus deferens is just the little tube that's actually carrying the sperm. So here's the testes where the sperm were made. Here's the epididymis where they get stored and matured and extra fluid gets reabsorbed, and then they come up here. Unless we had a major vasectomy, they're able to get through here, and they come along and all the way along here and down, and they're almost here. So the ductus deferens wraps around the bladder and comes down there as well on each side, of course. And this part here is just the widening part here is just the ampulla. I mean, that's not really that important. It's just really the end of the ductus deferens. It's about to be joined by the first of three organs or glands that are going to put their substances into in other words, add to the seminal fluid. So the seminal vesicles are here. This one's sort of been cut open, but there it is, and there's one on each side of the bladder, and they are providing actually the main amount of the seminal fluid is provided by them. So there's two of them, and so they're joining about there. So that means for a brief little period of time, there's a common duct between the seminal vesicles and the ductus deferens. So of course it needs a new name. So for some reason, that little tiny bit here is called the ejaculatory duct. So really ejaculatory would be all the way, but this is the urethra, which is simply being kind of borrowed for reproductive purposes. So the actual ejaculatory duct refers to that little bit. This purple thing here is the prostate gland. There's just one central prostate instead of a pair. And so it's right at the base of the bladder, and the urethra comes down through it. So people say it's donut shaped, but in fact the whole of the donut is pretty small. It's just around the urethra like that. So an enlarged prostate is going to squeeze on the urethra and make it hard to urinate. So there's our prostate gland. There it is seen there, and there it is in cross-section. So we can see the ejaculatory duct briefly comes through it. Here's the urethra, and that continues on out. And then the bulbourethral gland, they're also a pair, like the seminal vesicles, and they're just really small, little pea-shaped glands. There's one of them, and I guess we can only see one. Bulbourethral is a strange name. The bulb of the penis, you might think is this end, but in fact the bulb is the base. And so, and the urethra is here, so it's near the bulb and near the urethra, so bulbourethral gland. It used to be called the Cowper's gland, it is now called bulbourethral. So, here's the penis, here's the shaft of the penis. The bulb is kind of somewhere under there, so we can't really see it. The glans is actually the name of this rounded tip area here. A little bit softer. It's got the corpus spongiosum, which comes all the way around the urethra and then widens out to form the tip or glans here. The foreskin has been cut off. That's what gets cut off if you are circumcised, and so it would be just covering over here like a flap of skin, which is not shown in this model, so obviously a circumcised model. And then, so we had the corpus spongiosum here. The corpus cavernosum, of which there are two sort of tubes of erectile tissue, which get filled with blood, and that's what makes them stiff. So those are the corpus cavernosum there. So it doesn't go quite to the end, but it forms the stiffness in there. And then we have the urethra I already pointed out, and the actual urinary bladder, which I'll just obviously not part of the reproductive system, but I guess the urinary system's on here too, so there it is. Notice its crinkliness inside so that it can expand. So that's that. So any questions on this? All right. I'll just take this off altogether. So the mons pubis is just, here's the pubic region where the pubic hairs would be and the pubic bone underneath. And so it's just a little raised area of cushioning right here. The labia majora and minora, so the majora would be the major ones. So they're here and here. So the larger outer ones are the labia majora, which is mostly skin, a little bit of mucous membrane in here, and the labia minora is entirely mucous membrane there, although still stratified epithelium. And the vestibule, if we imagine that there's another labia majora and minora here as well, the vestibule is this little sort of common area. Vestibule is like when you go in a house and there's a little area to kind of take your boots off and then you go into the main, so that's a vestibule. So it just means a little entryway. And the reason that it even bothers to have that is we've actually got the urethra and the vagina obviously have to have separate openings. We can hardly have a baby through our urethra, but the sperm can get out there pretty easily. So unlike in the male, two separate places going through. So other than the vagina and the urethral opening, the clitoris is here, the stimulatory erectile tissue for the female. Here's the uterus. This is the cervix area. It's right down here where it's number 12 or whatever that 12 and 13 kind of thing. And then the rest of the difference between the fundus and the body isn't that big a deal. If we put the pointer right down on here, we'll just use these little things. So it looks like there's going to be judging from the numbers, there's going to be a couple on this one, a couple on this one. I'm just guessing. So, okay, so if it's right down there, it'll be the cervix, and if it's anywhere up here, it'll just be, you can just say uterus, that's fine. Then we've got, so here's the ovary right here, number 15, and that would be sort of the equivalent of the testes. It's for making the eggs and for making estrogen and progesterone. And then this is the fallopian tube, which connects the ovary to the uterus, kind of like the ductus deferens did a similar job of carrying the sperm. It's going to carry the egg. Often fertilization will occur in the fallopian tube. And this little part here is the fimbriae, kind of maybe similar to the epididymis, but it isn't really attached in here. What it is more like a funnel. So ovulation occurs, and its job is to try to make sure that the egg is guided along here, so it'll go along the fallopian tube. So that part's the fimbriae, and here's the rest of the fallopian tube. Ovary we had, urinary bladder, there it is, and urethra, there it is. And that's it.
Much easier than the other models.
It is easier. Partly, a lot of these things are people.
Prostate, yeah?
That's the prostate, right? I mean, a lot of these parts are parts of